Pathology, it has a huge intensity to it, trying to diagnose cases and solve the mystery of the case.
We are generating medical data that's important for the diagnosis and prognosis for disease.
While you're not really dealing with patients, you do solve a big problem and you essentially lead the path into recovery.
We're more like consultants to the doctors. One of the famous saying is pathologists are doctors' doctors.
There's no other specialty that comes closer to what the diagnosis is. If pathology can't get it, then nobody's going to come closer.
Every case is very exciting. Every day is very different. To me, at least, it's one of the most exciting fields in medicine.
There was just a feeling, I felt sort of at home here. All of the attendings are very approachable. And they always say, if you have any questions, come ask.
All the faculty know us. And that's important because that fosters this sort of collegial atmosphere that helps each and every one of us thrive.
The first year of the residency is really concentrated on learning how to combine the microscopic with the gross. But then as they progress, they do become more involved in translational research projects. And I think it's important because we are learning all the time.
Being a resident in a smaller program, you are very connected with your faculty. You cannot be missed in the sea of residents. We know at every moment in time what our residents are doing, how they are progressing in their training, and we want to improve their experience to make it better for them.
They are constantly in contact with people that are doing cutting-edge research.
We have consensus conferences where attendings will come and talk about cases that they might want second opinions on.
This is the go-to institution in the state. It attracts world-class folks from all over. We get really interesting stuff here. We get unique cases. Every week I see stuff I've never seen before. It's like solving a puzzle.
It's a little bit different from Boston hospitals in a way that we get lots of cases that you can work from bottom up, from scratch.
You develop this sense of how to work up a case because you've been through that same cycle of not knowing so many times that you just feel confident tackling everything.
Our residents are so fortunate to see a large variety of cases during their training. And they are very challenging. Many of our residents are publishing their cases in papers just because they discover something.
Research is very important for our department. Almost everybody ends up with at least a couple of publications when they finish. And they're not just case reports, they're like full studies. And the faculty do a really good job of getting us excited about that.
At the end of the residency, we see confidence, a huge growth in confidence, and I love to see them grow. I'm very happy when they are successful.